On the profile interview segment this week, I will be speaking with the national president of the Joint Health Workers Union, JOHESU. I'll be talking with JOHESU. It's good to have you join us on the program. Lots of things have been happening in the healthcare sector. Nigerian workers, be it doctors, nurses, pharmacists, they've been on the front line. Can you tell us, as the national president of JOHESU, what's been the feedback from your members?
It's a great question. Thank you. I want to use this opportunity to really express my real great satisfaction with the health workers generally, be it the doctors, nurses, health, lab scientists, technicians, even the other staff like the drivers, ambulance drivers, the electricians, biomedical engineers and all, even the administrators in the hospital setting. I want to really appreciate them, because this is a time that it takes the courage to stand by, to actually take the rigors of the duties that they are performing. I want to tell you that it's a mixed grill, talking about feedback from our members. Whereas the issues of discrimination is gradually dying up, we are also still yet, as we speak, our members are still doing the job without any real incentives given to them. That is the beauty of having a public health system. As for equipment, definitely no country in the world has been able to get 100%. But again, with us, we are not really also doing well, because every now and then complaints about the PPE is not adequate enough for them to actually protect themselves. And that's why you have got the high number of health personnel infected. We are praying every day that yes, it should just end that infection. Let it not climax to the point of losing plenty of or many of the health workers who are really risking their lives to serve the nation.
I'm very much aware, sorry to cut you, I'm very much aware that there was a point in time whereby your union actually came out to give out personal protective equipment to your members. Though we know that there are, some of this equipment is what you use regularly and probably you have to dispose. And I'm also aware that the number has risen, the number of health workers that have contracted this deadly virus has risen over the couple of weeks. Particularly, even here in Lagos, the Lagos University Teaching Hospital, LUTH, we've had complaints whereby we have lots of health workers who are down with the virus, and yet personal protective equipment are not provided for them. What would be your take on this? What do you think can be done? Do you think homegrown solutions can actually be brought forward at this point to ensure that we have less health workers being exposed to this virus?
Certainly, it's a very, very unfortunate situation that many health workers are going down. And whereas the number of infected persons is increasing, and then the number of those that ought to care for them is decreasing, that is very, very unfortunate. And the only way we can stem that is to actually concentrate on providing the protective gears for them. Like you said before, we provided the little we can that period. We are still, like my main union, the Medical Advocacy Union, is still also now preparing to send some PPEs, not the very, some sort of PPEs to some of our members across the states. But again, we are considering how to really transport these things to them. But we are working at that. We are working the logistics and then with the necessary ways that we can get these things out to them. I want to plead that all Nigerians, all well-meaning Nigerians, this is the time to show your love to Nigeria. You can imagine you send soldiers to fight the insurgents, the Boko Haram, and then you perhaps give them a gun, but you don't give them the bullets. How would they then fight? Or maybe you give them bullets. Maybe you give them bullets and you don't give them the gun. Maybe they use the bullets on a catapult and then start firing at the Boko Haram insurgents somehow. So this is a situation. So all Nigerians, this is the time. If you keep your money in the bank, and you don't help Nigeria, if you wait for just government, you know how poor the economy is now, with the sole dependent oil that we have depended upon.
Well, is there any way your union is actually trying to monitor palliative that might have been given to the government in terms of a lot of funds have been invested towards the fight against COVID-19? Would you say that they're not the appropriate authorities are not channeling the money to the appropriate quota, which is supposed to be to the health workers and also to the people that actually need to be cared for?
Remember, that's an area I would not really categorically tell you that we are doing a lot there, because in time past, my union, JOHESU members, in a bid to join the call for the fight against corruption, to fight corruption, our members have really suffered untold hardship. Salaries withheld. The same government that invited us, the same Ministry of Health that we were trying to rebuild, that invited us to fight corruption, after we blew genuine whistles, decided to put in place, no work, no pay, as a superior element to corruption, and then punished our members for doing the right thing. FMC Owerri is a typical example, jute, loot, everywhere, all over. In 2018 again, we went on strike, decrying the deplorable state of the health system.
And I've engaged you on that before, and you've announced to me once or twice that you still have your members who are being owed salary because of the no work, no pay. Can you expatiate more on that?
Yeah, thank you. You see, I want to tell you this. In 2018, we cried the deplorable condition of the health system, how funds are not dispensed properly, how funds are not really utilized in the appropriate areas. And what were we done? Punished. April, May salary is still owed. But the government is showing compassion to other sectors. Even when they went on strike for months, they paid them. They're coming to the critical health workers that cried for the good of the health system that would have saved millions of Nigerians. We are being punished. And today, it is becoming a widespread anger within the health system. We've only been trying to persuade the people that, look, because of the war we are in, they should show some understanding. But I don't know how much longer I will persuade these frontline workers who are now aggrieved that their salaries will be withheld because they cried for the bad health system that is here. Today, it is visible, even for the fact that we have been proven right. COVID-19 has proved to every Nigerian that what we have been crying for years is a reality. That should have sufficed for the government to come out and say, okay, these are our children. You cry. We thought you were crying foul or calling the wolf when the wolf wasn't there. The wolf is even big and is there. So come and take your money. And let us, even that should have been used as an incentive to build the sky, to hype up the morale of the workers at the front line. How can you be owing a health worker even today? Recently, it is the National Assembly that intervened to solve the problem of FCT. JOHESU issued their ultimatum. And if JOHESU members today will go on strike, the Nigerians who do not understand will say that we are being inhuman, that we are being inconsiderate. We have been shouting this for a long time. And we have written, and we are still saying now. The last time we went to Kano, that was outcry. Members were putting text all over my phone. Today, there are some sort of kind of displeasure that some associations are showing. It's all because they feel that JOHESU has not sounded the complaint so loud and clear. But I want to say that we have been proved right by COVID-19. The health system is in shambles. There is corruption in the health system. And so let our people who blew the whistles, let our people who went on strike for those reasons to make the Nigerian health system better be rewarded. If we are not asking for reward of blowing the right whistle and so come and give us interest or anything. No, just our salaries, our promotions that you have denied us. You have denied our members promotions. They've denied our members salaries, salary adjustment that would have improved our that have improved our living. Welfare. And because when the health worker is well cared for, that is when he can care for the sick. So, but everything went to naught. So if you ask me if we are monitoring the donations, I tell you, we are not involved at any level. We are not involved in the committees at a point where I'm telling you, both NMA and others as unions, I'm not involved. And because some people know that the unions, when they get involved, they will not close their eyes to the dirty things that will happen. Now they want to undercut the trade unions, the registered trade unions, and they are now pallying more with associations.
I would like you to expatiate more on the complaints that you just made that there is no way the union is going to be able to monitor the funds if the presidential task force, for example, does not include unions, union participation. What will be your demand at this point?
We have requested, even in our first press statement we made, we demanded that our members should be involved. They should be involved. So when you tell us that, okay, we have 10 PPEs, that will now enable us to know whether the PPEs are also distributed accordingly to need areas. Besides, when we now say you have distributed them, so that the unions can also monitor that, yes, 100 PPEs came to your center. At the base now, we now ask, are those PPEs given to the staff or to the frontline workers? That is the way we can get back information. But as we speak, I tell you, we are not part of these, the PTF, neither any other committees. So we cannot monitor. The only time sometimes we become like what they would term us to be like busybodies, to ask, we are hearing so much donation and that. What is happening? Sometimes they tell us that, most of the donations are only on paper, and sometimes it is those who are donating that are managing the donations.
Moving forward very quickly, we know lots of billions have been donated into the fight against COVID-19 in the country and across the world. As a country or as a nation, we've gone to the Sovereign Wealth Box. We've done a lot in terms of empowerment, in terms of ensuring that palliatives are given to the needy or the poor of the poorest, even though we know that we still have the working poor that are not being attended to. What will be your expectations when it comes to infrastructure? Because at the end of the day, post-COVID-19, would you still want to have the same standard of health care that we have that you can't actually boast of?
Thank you for bringing that question up. You see, recently, a member posted to me the statements of the vice president that he just presided over a meeting concerning the health system, and then he talked so much about privatization. I think he's leaning towards privatization as a solution. And we have said before now, privatization, if we are thinking that it is privatization that will solve the problem of this nation, then it will be worse if another COVID comes. I say without fear or favor. Let me tell you, United States of America is the most privatized health economy in this country, in this world. United States of America is suffering so much because they depended on the private sector, they abandoned their public sector, and so when the time came to fight, private people must talk about their profits. They must break even if they want to be, say they want to be very generous. They must break even. But for the public sector, like I told you now, we have signed an agreement on improving the hazard allowance. That's the government side, for the government workers. Till date, as I speak with you, no kobo has been paid to any health worker from that day to now. But because we are public health workers, we still have the heart and the mind to serve the nation. We are still working without getting additional kobo. And some of us, like I told you, are being owed months of salaries, and we are still working. If it were to be a private sector arrangement, nothing will happen. Therefore, I say that any intent to privatize the remaining public health institutions, in fact, all the public health institutions should be returned back to the public sector. They should rather be funded better, and then corruption should be taken out of these public institutions, because we have the manpower, we have the personnel. We may have shortage of manpower, but we have the available ones are capable of doing the job. So let us encourage them, encourage the public health institutions, especially at the primary health care level, Let us rebuild the primary health care system and the secondary health care system so that the burden will not be majorly on the tertiary. We should have been doing better things than taking care of everyday malaria and other issues. So I want to say that, look at Nigeria's budget. We are still far from the 15% that we are talking about helping ourselves with. The Abuja Declaration. We are still far from it. We are running between 4 and 6% in the past decade. So how do we grow? And then they will say the public health institutions are not working. So they want to privatize. As I speak with you, more than 75% of health institutions in Nigeria are owned and run privately. That is not my own position. It is the position of the Guild of Medical Directors. They provided the data, which I'm quoting. So if you have over 75% in private hands, yet Nigerian health system and health reaction is so poor, why will you blame the public health? That you are not even funding, that you are not even putting the right things. When even we talk about corruption that is destroying the system, you hammer us again. So I want to say, for post-COVID, Nigerians should help us this time. Come and help us, the unions, from telling the powers that be that they should do the things we are asking for. They should improve the infrastructure in the public health institutions. They should re-equip the infrastructure in the public health institutions. All our National Assembly, all the National Assembly men, the political class, all of them, no one is going to either UK, America, or India for medical assistance, but they are being treated by Nigerian medical personnel now. They are still healthy.
They've not
working
died.
along with us. So if they put more in us, we'll be able to deal with the situation in Nigeria.
Thank you very much for joining us on the program. Of course, there's the need for increased funding in the healthcare sector, and there's a need for more commitment and lots of personal protective equipment to ensure that the number of health workers that will contract the virus probably will be reduced to the barest minimum. And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember, labor creates wealth.